Simmons with the Ohio Herbal Clinic, a medical marijuana clinic in Columbus, Ohio. So I attended the Medical Marijuana Advisory Committee meeting today to try to get an update on the program. It was a really interesting meeting today. The main thing that I tried to get a grasp on was the time frame. Patients are really wanting to know when they're going to be able to get their medication. So what they're saying is that all the wheels are in motion. There's a lot of moving parts with the program. The growers are growing. The processors, they have 13 licensed processors, none of which have gotten their certificates of operation quite yet. They're thinking that's probably going to happen in November. And then there are the testing labs, which also have yet to get their certificates of operation. There's 5 licensed testing labs. So it appears that all these things are going to come together in November, which potentially would put medication on the shelves in dispensaries possibly as soon as January. I didn't hear any different date than that today. So I think we're still hopeful that potentially there'll be medical marijuana hitting the shelves at the end of the year, if not January. So in a time frame such as that, this is probably putting the medical card still in November, when the online patient registry will open and physicians with certificates to recommend can go on and register their patients, and then patients can then go on, pay the state pharmacy $50 online, and complete their registration and print out their medical card. Another piece of information that was shared was cost, and so that's something that hadn't been brought up in the past, but they're anticipating that initially when the medical marijuana reaches the dispensaries, there's going to be a very small supply, and because of this small supply, the cost is going to be pretty high. The example that was used was approximately 8 ounces or half a pound of marijuana, tier 1 bud or plant material, which they're expecting to hit the shelves first. It'll probably be bud or plant material, not your concentrates and some of the other formularies. But they're expecting that 8 ounces of that is probably going to be upwards of $2,000 initially. And then as more supply comes through the program and hits the shelves, then that price will probably be driven down. So interesting day today. It sounds like things are still on progress. Hopefully we're getting medical cards in November. Hopefully we're seeing some product hit the shelves December, January. And that's the timeline and the update I have for you. Until next time, appreciate you tuning in.